What tests are used to diagnose pancreatitis? Imagine feeling a sudden, intense pain in your upper belly that radiates to your back. That could be a sign of pancreatitis, but doctors need more than just symptoms to confirm it. Diagnosing pancreatitis involves a mix of clinical evaluation, blood tests, and imaging studies. The specific tests depend on whether the doctor suspects acute or chronic pancreatitis. Blood tests are usually the first step. The most sensitive test for acute pancreatitis is serum lipase. If this level is at least 3 times higher than normal, it strongly suggests pancreatitis. Lipase rises quickly after pancreatic injury and stays elevated longer than amylase, giving a wider window for detection. Serum amylase can also be elevated in acute cases, but it tends to return to normal faster and is less specific, so lipase is preferred. Other blood tests include a complete blood count, which can show increased white blood cells indicating inflammation or infection. Liver function tests help identify if gallstones or bile duct issues are involved, and blood glucose levels may be higher if the pancreas's ability to produce insulin is affected. For chronic pancreatitis, blood levels of amylase and lipase might be normal or only slightly elevated. Additional tests like fecal can assess how well the pancreas is functioning in secreting digestive enzymes, and serum trypsinogen can also provide clues about pancreatic health. Fecal fat tests might reveal malabsorption caused by pancreatic insufficiency. Imaging studies are crucial for visual confirmation. An abdominal ultrasound is often the first choice because it's quick, safe, and can detect gallstones, which are a common cause of pancreatitis. It can also show if the pancreas is swollen or if there are fluid collections. However, ultrasound can be limited by body size or bowel gas. If more detailed images are needed, a computed tomography scan with contrast is the gold standard for acute pancreatitis. It helps confirm inflammation, identify complications like tissue death or abscesses, and assess how severe the condition is. For detailed images of the pancreas and bile ducts, magnetic resonance imaging combined with magnetic resonance cholangiopancreatography is very useful. It can detect duct blockages, strictures, or stones, especially when ultrasound results are inconclusive or when evaluating chronic pancreatitis. To diagnose acute pancreatitis, doctors usually look for at least 2 of 3 key signs: severe upper belly pain that often radiates to the back, blood levels of lipase or amylase that are 3 times higher than normal, and characteristic findings on imaging. Chronic pancreatitis diagnosis is more complex. It often relies on a combination of patient history, imaging results, and pancreatic function tests, such as fecal elastase 1, which measures enzyme levels in stool, or secretin stimulation tests that evaluate pancreatic secretory capacity. Fecal fat tests can also reveal malabsorption issues caused by pancreatic insufficiency. In summary, diagnosing pancreatitis involves a careful combination of blood tests like serum lipase and amylase, along with imaging techniques such as ultrasound, computed tomography, and magnetic resonance imaging. These tools help doctors confirm the diagnosis, understand the severity, and identify underlying causes. Always remember, if you suspect pancreatitis or experience symptoms, it's essential to consult a healthcare professional for personalized evaluation and care.